Okay, I want to deal now with something that many of you and I have been noticing about coronavirus lately. Cases have exploded. I mean, just insane numbers of cases. And it's specifically in some states and not in others. But the death numbers have not been high for now. That's a good thing. I don't want anybody catching coronavirus. I don't want anybody dying from coronavirus. But the question is, based on the case numbers, we would expect deaths to be higher in some of these states, especially ones where we're learning that the ICUs are maxed out. So what's going on there? Now, as a reminder, I have no political perspective here. My ideology on the virus is health. It just so happens the president we have has failed miserably on coronavirus, but I want to find the real explanation and I want to find the truth. So here's a few ideas that have been proposed about why there have been so many cases, but relatively fewer deaths than we were seeing a few months ago. Okay. One possibility that's been proposed is that we are getting better at treating coronavirus. In other words, if you get sick enough to go into the hospital, doctors are now better at treating because we have 3 months of experience, and thus you would expect the death rate to be lower. In fact, there is a study called Decreased in Hospital Mortality in Patients with COVID-19 Pneumonia, and it says that in a lot of countries, fewer people are going to the hospital and dying, and it's a combination of some hospitals being less overrun with a better understanding of how patients should be treated. Reminder, that's why we lock down. When you lock down, you keep the hospitals less full, so the sick people get better care, and you allow time for doctors to learn to properly treat the disease. So hopefully by the time you get it or your loved one gets it, the medical system is better equipped to treat. Very good. That's one possibility. Second possibility for why there are a ton of cases and not as many deaths is that we just haven't seen the deaths yet. Okay. The idea in general is it's like 22 days from test to death. You get a positive test. It's often 5 days before you end up in the hospital. It's often 17 days from hospitalization to death. So it's like a 22-day delay between cases and deaths. The current spike started, I call it June 16th. If this is the explanation, that we just haven't seen the deaths yet, we would expect deaths to spike around June 7th or 8th. I hope it doesn't happen. If it is that's what's going on, the death numbers are going to get very, very ugly very, very soon. Third possibility for why we have so many cases and relatively few deaths is that older folks are better protecting themselves and staying home. And it's the younger people that are testing positive. Younger people, much more likely not to need hospitalization, much less likely to die. That would be a possibility. We don't have the full data on that. That's really an empirical question. We just don't have the full data on that. So we would have to see. I know that there are some cities that are saying we are seeing more young people get it, fewer older folks get it. We need to see that at the state level, at the federal level. Lastly, there are some doctors arguing that the virus is mutating to be less serious, that at this point, the virus has weakened, and thus those who are infected are getting a less serious version of it than what was going around in March, April, and early May. I don't want to say too much about that because we don't know that to be the case. It's a hypothesis. It presumably could be tested empirically. That's not been done. Most doctors are saying there is not actually evidence of that right now. And so I don't want to risk giving people the wrong idea with something that has not been demonstrated to be true. Still a lot to learn, but those are four of the possibilities for why so far we are seeing unconscionable spikes in the number of cases, but not yet seeing. And hopefully we won't see corresponding numbers of deaths. Let me know what you think about this.